Hey everyone, it's Sarah with RegisteredNurseRN.com, and in this video I'm going to go over how to study for geriatric nursing. Now in my previous videos I talked about how to study for medical surgical nursing, pharmacology, and all those other nursing classes. So if you're interested in those classes because you're having to take them, be sure to check out those videos. But in this specific video I'm going to go over 6 strategies on how you can prepare for these exams in your older adult class, because there are some things whenever you're preparing for your exams that you need to concentrate on so you can ace it. But let's first talk about what this class is about and what it entails. This class focuses on the care of patients from the age of 65 or older. And this class is also called by some nursing school programs care of the older adult or geriatric nursing. It's the same class. And these specific patients, they require special attention in nursing because they are undergoing psychological and physiological changes that an adult isn't necessarily going through who is about 18 to 64. So just like in your pediatric class, in your maternity class, we have to provide specific nursing interventions and care to them. And this is the same thing with our older adults. So why do students struggle with this class? The older adult will typically present clinically different with diseases and illnesses compared to the adult of what you've been learning in your other classes. So it's going to require that you add new knowledge to other disease processes you already know, and you're going to have to learn new different concepts. And second, some students just aren't interested in geriatric nursing. Their heart is already set on pediatric nursing, OB nursing, and they just get that. It comes natural to them. So older adult nursing, the interest isn't there, so it's a little bit harder. So let's talk about those 6 strategies on how to study for these exams in this class. Okay, number 1, whenever you're preparing for your exams, you need to understand what are the normal physiological changes for the adult that take place in the older adult? Because it's going to make sense why they get certain health problems. For instance, as an adult ages, becomes an older adult, the renal system starts to change along with every other system of the body. And one thing that starts to happen is they start to have increased residual in urine whenever they're urinating, so they're not completely emptying out their bladder, and this causes problems for urinary tract infections. So a lot of times you're going to be encountering older adults with UTIs. And also, they start to develop problems with chewing. Maybe they're losing their teeth, or their jaws hurt and they can't chew as much, or they have difficulties swallowing. These muscles get weak in the neck. So they're at risk for aspiration. So whenever you're giving them medications, you may have to crush them. So you need to know what you can crush, what you can't crush. And they're also at risk for nutrition problems because they may not be eating well because they have pain. So if you can understand what is normal, what's happening to the older adult as they age, everything else will make sense on exams because test questions love to hit on that. Okay, number 2, know the signs and symptoms of infection or possible illnesses. The key with older adults that your professor will probably hit on early on is that older adults do not present the same as an adult with an infection. Chances are they're not going to have a fever. They're not going to have those classic signs and symptoms. They may all of a sudden come in and have a mental status change where they're confused, or they've been falling a lot more, or they have just an increased heart rate, increased breathing. And then they draw blood and they see that their white count's high and that they have an infection. So know what's going on with the older adult if they're confused. Maybe it's an infection, maybe it's an adverse reaction. So those are things you'll want to pay attention to whenever you're studying your key concepts. Okay, number 3, concentrate on reviewing nursing interventions for how you will deal with chronic and acute problems. For instance, if you get a study guide for this class or you're looking in your textbooks, make sure you are paying attention to what you're going to be doing as the nurse. Because again, test questions love to hit on, give you a scenario and tell you, what is your nursing intervention? And you'll need to know what older adults struggle with chronically and acutely. For instance, a lot of older adults have issues with constipation. And we know from the normal physiological changes with adults that their GI system slows down and they're at risk for constipation. So what are you going to do for that as a nurse? You're going to educate them about increasing their activity, because a lot of times older adults that have sedentary lifestyles. You're going to talk to them about increasing their fiber intake. What foods contain fiber? A lot of questions like to ask that too. And how to stay hydrated. Keep the water on, because a lot of people, especially older adults, they don't drink as much and they're constantly dehydrated. So those are nursing interventions that you would select as your option on that test question. Okay, number 4, know the older adults' issues with medications. A lot of older adults are on medications. It happens. It's just one of the normal processes of aging. And as the nurse, you need to know safety precautions with that. You need to know adverse reactions, because like I said, the older adult isn't going to present with those common classic adverse reactions. They may, all of a sudden you start them on a new medication, they may just all of a sudden become confused. So that's the thing you need to watch out for. And they're at risk for polypharmacy, meaning that they went to different doctors or a different pharmacy, and the pharmacy has them on this and that, and sometimes some patients have duplicated medications, or they're taking too many, and some of those are unnecessary, so they're at risk for that. And as a nurse, it's your responsibility to look at those and call the doctor and ask, maybe, does this patient really need this, things like that. And how to take the medication properly. And that comes back to their aspiration risk or the difficulty swallowing, and how to tell them how to crush medications, what medications you're not supposed to crush. For instance, for tests will give you a scenario telling you that you have a patient going home on a certain medication. Say it's an enteric-coated medication. And which statement by the patient would make you cause concern that you have to re-educate the patient because the patient is aspirating. And one of the statements would be that the patient states, I will crush my enteric-coated aspirin and put it in applesauce before I take it. And that would be the option that you would pick, where the patient would need to be re-educated, because you never crush an enteric-coated medication. So those are some things you want to pay attention to with that. Okay, number 5. Understand safety precautions and signs of older adult abuse and neglect from either others or by themselves, because this patient population is at risk for this, just like your pediatric patient that you'll learn about in peds. So you need to know those subtle signs and symptoms that an adult is being abused, because these are really lecture exam questions that professors like to hit on, and the NCLEX as well. And some of those subtle symptoms are that the patient plays down the injuries, they don't have a really good response to it, and how they interact with their abuser. They may be afraid every time that potential abuser comes in the room. It's just a little red flag going off to you as a nurse that you should investigate it further. So concentrate on that in your book whenever you're studying. And number 6, last but not least, commit those theories of aging to memory. The theories of aging, one of them is disengagement theory. A lot of lecture exams, your professors like to throw out those different aging theories and give you a scenario and ask you which of those theories it is. I've noticed that that's really common test questions. So for instance, you have a scenario and it says a patient's daughter reports that the patient has been withdrawing and is being less involved in activities that they used to like to do. Which of these aging theories explains what's happening? And the answer would be the disengagement theory. Okay, now let's go over a typical exam lecture question that you may encounter in older adults. And let me just give you a sample of what you may encounter. Okay, let's look at this sample question. A 75-year-old patient is showing signs of malnutrition and has lost 20 pounds in 2 months. The patient's daughter reports the patient has shown less interest in food over the past 3 months. Which of the following may contribute to the patient's loss of interest in food? Okay, let's look at our options, and we are going to be making sure that we're asking ourselves, okay, what does the older adult normally, physiological changes do they experience, and what may be causing it? Okay, A, fitted dentures. B, ease of swallowing due to the relaxation of the esophagus causing potential aspiration. C, altered sensitivity and amount of taste buds. Or D, excessive mouth secretions. Okay, so let's analyze these one by one. A, fitted dentures. Well, most older adults do get fitted dentures because they lose their teeth, but fitted dentures, if they're fitted properly, which they are here, would not cause a patient to lose interest in food. I think there's a more of a bigger cause to that because fitted dentures are actually going to help them eat their food. So this isn't a very good option. Okay, B, ease of swallowing due to the relaxation of the esophagus causing potential aspiration. Well, we know that this is absolutely a wrong statement because remember, whenever you're answering these questions, you need to ask yourself, is this a true statement? Well, older adults, they have difficulty swallowing, and it's not because the esophagus is relaxing. So this is not a correct response. So we know it's not B. And let's skip down to D. Excessive mouth secretions. No, actually older adults, one of the normals, physiological changes is that they have dry mouth problems. So we know it's not excessive mouth secretions. And C, altered sensitivity and amount of taste buds. Well, one of those normal changes that happens as you get older is that your taste buds may change the way that they normally taste foods that you absolutely love. They may all of a sudden taste too sweet, taste too bitter, and there's not as many taste buds as normal. So this could contribute to the reason why the patient has lost interest in food. Maybe it just doesn't taste as good anymore. So this is the best answer. So C. So see how having to know what's normal for the older adult and what nursing interventions you can do based on the older adult helps you when you're trying to answer these questions. Okay, thank you so much for watching this video on how to study for geriatric nursing. Be sure to check out my other videos on how to study for your other nursing school classes, and please consider subscribing to this YouTube channel.